I was seeking clarification on this presumption. A letter dated 20 December 2018, Monday 7th of 1st, 2019 now, 3:40 to 3:50, their phone cut off, was to disabled people, my situation anyway, to, in 109 Kingdom, my conditional acceptance of offer, rejection without dishonour, and an email was included of a letter going back in August last year to a maxillofacial outpatients department, they call it, the local hospital, NHS Foundation, well, it was a trust, NHS Trust, funded by the NHS England Limited. That's all over the news today about what they're planning for the NHS UK for people. Well, this is a bloody joke. Unfortunately, how complexity is on top. It's not as simple trying to access anything nowadays. This was reference to a saga going on since August 2017. Lack of transport, lack of access, disability reason adjustments, you name it, was going on then. So I didn't want the same experience leading up to a referral. I didn't know that this w.dense, it never was like that back in 2017, and I found out that the cutbacks means they censor where people are, whether or not they're going to get offered to a dental maxillofacial hospital. They call it secondary services. Because of my physical complexity, adult health, social care, housing, everything combined, it's deteriorated. And on top of that, to the operation, well, date of the initial referral, and 2 p.m. afternoon. Unfortunately, anticipate the day on the 6th of July 2018, nor did I anticipate the funeral will be on the 10th of the 8th, 2018. I was not in a fit state to confirm or to consent to any coping with anything like that. And then I was in the middle of the leading up to that period of time and since to date, trying to access, they call it in United Kingdom, as a vulnerable adult, right? In their terminology, in the system, adult health, social care, right? And what may and may not be offered, and whether or not there may and may not be a care plan offered in replace the reduction of my health since last September. And then obviously I've been in hospital since September 2018, a head injury, and I've reduction of my health. So I was a phone call to see. There was a DNA letter automated to the department, and I gave straight just enough information to aid them to assist me. So basically, with statutory law, the national press in the United Kingdom all over last year, I did some posts about the cutbacks at adult health care, meaning I cannot get access to what I need. Right, so since then, towards the latter part of last year, I source information via NHS England Limited, funded nationally, individual my situation messaging stream, while the local health care departments, various prevention, physical joint, just been trying to, getting really dark already, so it's really bad. And when I checked out digital referral site, dental, when you're on medication because of risk, the aesthetic, when you're on medication as well, that's to happen after. And being to be a working process, unfortunately, you're in my situation, unfortunately, because a medical, adult health, housing, you know, you just see the shows about housing, my goodness, that's another story. But moving forward, I don't particularly want to seem to be as a complexity situation, so the phone call today was seeking clarification about the national NHS choice, whether that's changed, in where one can be offered an operation. I refer to initial consultation with consultants, and what subject, in my situation, this particular subject today is about dental. And And then the lady said to me, well, we just need to go back to the drawing board, which I already knew about this. The National NHS Constitution means you do have a right. And drawing health, mental healthcare, adult care combined were deemed that more suitable to go strictly. But still, anyone who trained, you have a lawful right to act at services and services in statutory law 2000, Quality Act 2000, Section 21, 21 and 22. But that's for any service, and whether it's private limited companies or public funded. And unfortunately, and now even more so, they don't have the funding, but they can do or they offer a hospital transport. Unfortunately, they hire a different company, private limited company, and they messed me about in 2017. I don't want the same again, not with what I'm going through still, unfortunately. So what I did try to do was access my medical notes to see, because I just absolutely could not believe half the things that's going on. But since then, I couldn't type anything. So before Christmas, New Year, two letters went off at the same time, dated Monday, the 10th of 2018, 13th, 12th, 2018. One was seeking clarification on my medical data access, which under statutory law, May 2018, data protection, all individuals have lawful right to access in CD format free of charge your medical data. These medical company, medical business, wherever you are, United Kingdom, my area, especially in England, in East UK, it's been 5 months delay. It was months today, 2018. And seek clarification, because what they use is system-wide based computer system, and how that is used, it's so all healthcare professionals, there's a register where they have to sign up, either social workers, whatever health capacity they're working in. But we're talking about not just ordinary men and women doing their job, trying to. We're talking about directors, board directors, CEOs, higher paid ones of the expense of the public taxes, okay? Making key decisions to restrict access to services for those that need it, those really do need it. Don't have any other option, can't go private, got the finance. And this is now not just local. He's made an announcement as per usual, and as did the CEO of NHS England Limited. Yes, it is a limited company. You can do the research. Company's house is public knowledge. You'll soon find out the combination, the difficulties when, God forbid, when anyone else experiences I have, the breach of statutory lawful duty of care in all areas when one is needing not just dental services, but any other NHS services. I also previously email, it's not me, but I'm deeply targeted, being assumptions being made, claiming that individuals failed. So if you didn't hear back, it's about the NHS, and hopefully you did hear some of this. I need to cut this off now because the weather's really getting cold. Thoughts are with whatever you're and struggling with a lot of ill again today. National NHS Choices website, check it out, about yours to be able to access research on where you may be able to get this. It's known as secondary referrals to consultants if you're waiting a certain period of time. Like for me, with my feet, I've got a major issue going on with my right side. Unfortunately, I've got injuries over the past 2 days on my right side. Bad luck, which has really deteriorated my physical body health today. So today, woke up. So it doesn't help when you have a bereavement family and you're trying to move on to get access to other statutory services in the UK when you don't have funds or happen like that, do they? It all seems to be bombed all at once. But for those that seem to be able their cause and is just seek verbal clarification, because the individual that works in a certain department doesn't use the email that she could have done and she's got. And I've got proof of posting and other letter to the medical practice to get my medical records, and they've again in dishonour, and it's now 3 weeks delay on top of everything else again. So their breaches policy to offer. Now it could just be human error, and there's so many people to deal with and so many people in a similar situation. Could be that, but come on, you don't have 6 months delay to get my medical records. They can limit what access medical information if you're one of an adult with certain disabilities and feel it might harm you. That is in the statutory documentation known as Data Protection Act 2000 and May 2018, Data Protection Act, statutory law. Now, I sought clarification, all copies are online referrals. That I knew about 3 of them, and I needed clarification what was said about me, and I gave the dates roughly when they were made, and sought clarification on those, and basically sent back I did not fail to attend and offer services and to a local hospital, and that had to be handwritten. I can no longer do any type, and that's why I can't do type letters, and that's. You tell me, any medical individual out there, you work and pay privately or via the NHS system, why do you not use people's emails when they provide it, especially when you've got vulnerable adults, disabled people that prefer that communication contact because of a certain person situation and disabilities? It would be extremely helpful, but unfortunately you're fail to be honourable in that. So just going to end it there. This went off to medical, in her job role as a medical practice. She is the data controller and for medical, if they're in at the phones, but like by Skype. I mean, I'm going to have appointments by Skype. They're going to be software going to introduce to have NHS England funded, where you're now going to have offer to have a consultation with a medical practitioner or consultant online, and it's like by video link. I mean that would be helpful for my situation, housebound. But then, how is people going to be offered the software you need and computer connection and the internet connection to do that? Question mark on this one. At least you can store on software. My mates taught me with it moving forward. So it's my today. I can't get out and about today. It's one of those days where yesterday you just go out literally the back door with a rubbish bag and the weather hits you and you wake up really run down, really bad. So yeah. You get the chills, and this is the environment. It's not just inside your home. If you open the windows, the pollution, the air, and cold weather can get into your home. Next minute, you're hot and cold, and it's a sign of the chills and stuff. And all you can do is hot lemon and the vitamin C and just rest. So it did take a lot out of things I need. Life. Trying to cut cost-effective ways of doing this cheaply. And well, you get posting, you've done the best you can. So I haven't, as I said, been able to out. So my call was today before a certain and I need this website and share it. God bless everybody. Whatever your situation, the Constitution, look it up if you're in the kingdom and read or download or get to help you to know what your rights are to access services when all these cutbacks and services going on. It's only going to get, unfortunately, much worse, but God bless, keep safe, sign out, UK.